Hello everyone, welcome again. Today's we have the topic keratitis. So what is keratitis? Here is we can learn about definition, introduction, type, causes, sign and symptom of keratitis, diagnosis of keratitis, and finally treatment of the keratitis. So what is keratitis? Keratitis is an inflammation of the cornea, the outermost part of the eye that cover the pupil and iris. The color ring around the pupil. The most common causes of keratitis are infection and injury. Okay, keratitis is an inflammation. Keratitis क्या है? Keratitis is an inflammation of the cornea, the outermost part of eye that cover the pupil and iris, the color ring around the pupil. The most common causes of keratitis are infection and injury. Okay, so this is the most common causes. It's happening after the injury of eye. It is the most common cause, infection or injury. It is the inflammation of the cornea. It is known as keratitis, outer part of the eye that cover the pupil. What is cornea? Cornea is the outer part of the eye that cover the pupil एंड आइरिस पर और आपके कॉर्निया में इन्फ्लामेशन होना, स्वेलिंग होना, इट इज नोन एज द केरेटाइटिस. द कलर रिंग अराउंड द प्यूपिल्स, द मोस्ट कॉमन कॉज केरेटाइटिस आर इन्फेक्शन और इंजुरी. इन्फेक्शन और इंजुरी की वजह से आपको इन्फ्लामेशन होना है, आपके कॉर्निया में इन्फ्लामेशन होना, आउटर मोस्ट जो आपका आइस का पार्ट होता है कॉर्निया में, जो कि प्यूपिल्स को कवर करती है आइरिस में, इसमें आपका इन्फ्लेमेशन होना, इट इज नोन एज केरेटाइटिस. Keratitis or corneal ulcer cause can include. There are the several various factor that can cause keratitis, including bacterial infection, viral infection, fungal infection from plant material in the eyes. Next, a parasitic infection, improper cleaning and or care for contact lenses, wearing contact lens too long, injury, starch, vitamin and deficiency rare. Okay, so all these are the symptoms like bacterial infection, viral infection, fungal infection from the plant material in the eyes, parasitic infection and improper cleaning. आई लेंस का जो आप यूज कर रहे हैं तो improper of the cleaning, care of the contact lens का improper care होना, wearing contact lens too long, बहुत ज़्यादा लंबे समय तक contact lens का wear करना, इंजुरी होना, आपकी स्टार्च की वजह से इंजुरी होना, विटामिन ए की डेफिशिएंसी होना. इट इज द रेयर बट समटाइम मे बी सीन. ओके, next is the symptom of the keratitis. Symptom include the red eyes, sensation of something like sand in the eyes. Okay, so first we have the see symptom like red eyes होना, sensation of the something, कुछ आपको sensation होना like आपका sand in the eyes. आइस में आपका सैंड है, इस तरीके का आपको सिम्टम्स होना, पेन होना, सेंसिटिविटी टू लाइट, लाइट से सेंसिटिविटी होना, वाटरी आई होना, ब्लर विजन होना, डिफिकल्टी कीपिंग दी आईलिड्स ओपन, आईलिड्स को ओपन रखने में आपको डिफिकल्टी कॉज होना. when caused by an injury or infection such as herpes simplex virus, keratitis usually affect only one eye, but both eye may be affected when keratitis is due to other causes. So when caused by an injury, in case it is caused by an injury or infection such as herpes simplex virus, so keratitis is usually affect only one eye. Okay. In case it is caused by the virus, viral infection like simplex virus, herpes simplex virus, so keratitis is usually affected only one eye, but both eye may be affected when keratitis is due to other causes. Correct. In case आपका जो infection है, you get infected from the herpes simplex virus, keratitis is usually affected only one side, but in case it may be affect when any other causes, any other region, so involvement of the both eye are there seems. Correct. Next is the bacterial keratitis, common pathogens like आपका Neisseria gonorrhea, Corynebacterium, diphtheria, Listeria sp, Haemophilus sp, right? So all these bacteria are the capable to cause the infection like Neisseria gonorrhea, Corynebacterium diphtheria, Listeria sp, and Haemophilus sp. Gram negative and gram positive bacteria are also there. Staphylococci, Streptococcus, Neisseria, nocardia, etc. Right? So all these bacteria have to cause the disease. Sign: scleritis can develop particularly with the severe पेरिलिम्बल इन्फेक्शन. ओके, सो साइन में क्या क्या हो सकते हैं कुछ इस तरीके से यू कैन ऑब्जर्व लाइक दैट. आइस आपको इस तरीके से दिखाई देगी. स्क्लेराइटिस होना आपका कैन डेवलप पार्टिकुलरली विद द सीवियर पेरी लिम्बल इन्फेक्शन. सीवियर पेरी लिम्बल इन्फेक्शन होने की वजह से आपको स्क्लेराइटिस हो सकता है. एंडो एंडोप्थेल्माइटिस हो सकता है द रेयर केस में इन द एब्सेंस ऑफ द परफोरेशन. एब्सेंस इन रेयर केस में एंडोप्थेल्माइटिस is rare case in the absence of the perforation epithelial defect with the infiltrate involving a large area and significant circumcorneal junctions. Next is the investigation. What investigation should be done? So first is the corneal scraping for culture and sensitivity. If small infiltrate without epithelial defect and away from the visual axis, then it is not required. Okay. So here is the investigation we can do for this disease. First is the, if small infiltrate, in case there is a small infiltrate without epithelial defect and away from the visual axis, then it's not required. If small infiltrate is there without epithelial defect and away from the visual axis, then it is not required. Okay, in case conjunctivital swab, we can take conjunctivital swab, contact lens cases, as well as bottles of solution and lenses themselves. The case should not be cleansed by the patient first. Gram studying next. Contact lens cases as well as bottles of the solution and lenses themselves. The case should not be cleaned by the patient first. Next, gram studying. There is the list of antibiotic we can prescribe for the treatment. Like antibiotic आपका फ्लोरोक्विनोल and monotherapy or cefusim, fortified gentamicin and duotherapy. ग्राम पॉजिटिव कोकाई के केस में है आपका सेफ्यूरोसिम, बैंकोमाइसिन एंड टिकोप्लेनिन. ग्राम नेगेटिव रॉड सेटो फोर्टिफाइड जेंटामाइसिन और फ्लूरोक्विनोन एंड सेप्टासाइटिन. ग्राम नेगेटिव कोकाई है तो आपका फ्लोरोक्विनोन, ग्राम नेगेटिव कोकाई है तो फ्लोरोक्विनोन और सेप्टिसोन. नेक्स्ट माइकोबैक्टीरिया की वजह से हुआ है, देयर इज अमीकासिन और क्लेरिथ्रोमाइसिन. नोकार्डिया की वजह से हुआ है तो अमीकासिन और ट्राइमिथोप्रिन एंड सल्फामिथेजोल एक्सेट्रा, ये हम दे सकते हैं. So all these are the antibiotic treatment we can give the patient. Now steroid are the reduce host inflammation. It is provided because of the reduce the inflammation, improve the comfort and minimize corneal scarring. However, they promote replication of some microorganisms, particularly fungi, herpes simplex, and mycobacterium, and contraindicated if a fungal or mycobacterial agent is suspected. By suppressing inflammation, they also retard the eye's response to the bacteria, and this can be clinically significant, particularly if an antibiotic is of limited effect or bacteriostatic rather than bactericidal. Okay. reduce host inflammation, improve comfort, and minimize corneal scarring. Steroid is the reduce host inflammation, and for the reduce of host inflammation, improve comfort, and for the minimize corneal scarring. However, they promote replication of some microorganism. However, they can promote replicate of some microorganism, particularly fungi, herpes simplex, and mycobacteria. Next is the contraindicated if a fungal or mycobacterial agent is suspected. While suppressing inflammation, they also retard the eye's response to the bacteria, and this can be clinically significant, particularly if an antibiotic is of limited effect or bacteriostatic rather than bactericidal. Right? Next one is the surgical treatment, tissue adhesive. Surgical treatment first is the tissue adhesive, second is the cyanoacrylate glue, small perforation less than 3 mm. Next is decimatosil. This is the visual rehabilitation, keratoplasty. Lamellar may be adequate may be required for the residue dense corneal scarring. Rigid contact lenses may be required for the irregular anti-mastic. What are the generally only introduced at least 3 months after the epithelialization? Cataract surgery may be required because secondary lens opacities are the common following the severe inflammation. Next one is the viral keratitis, herpes simplex virus, varicella zoster virus, herpes zoster ophthalmicus adenovirus. Next, clinical history. A patient with the HSV keratinitis may complain of the following: pain, photophobia, blurred vision, tearing, redness. Okay, so all these history are there. Clinical history. May patient with the HSV keratitis may complain of the following: pains, photophobia, blurred vision, tearing, and redness. All these are the clinical symptoms. A history of prior episode of patient with the recurrent disease may exist. Treatment is also there. First is the medical treatment. Already we see there, and oral antiviral drugs, tricyclic antidepressant. Next is the complication. If not treated on the time, it have multiple complications. It will arise after the some time when we ignore or we not treated promptly. So papan, there is the severe acute pain 90%, infectious scarring less 85%, conjunctivitis, scleritis 75%, lid distortion 70%, infectious and or immune keratitis 55%, uveitis 45%, phn 20 to 60%, age less than 40 to 60 year, glaucoma and or cataract 10%, neuro ophthalmic 8%. Good. Prevention is also there. The best way to prevent keratitis is to avoid eye injury by wearing sunglasses and appropriate eye gear as needed. If you have a cold sore, do not put your finger to your eyes because that could spread the infection. If there is any suspicious that you have herpes simplex virus, steroid eye drop may be dangerous because they can make this infection worse. Routine contact lens hygiene, a balanced diet, and moisturizing eye drops may help prevent other causes of keratitis. Okay. So thank you. I hope you understood. Like image is like that. When you have keratitis, your eyes visible like that. So I hope you got it. If you have any doubt regarding this, you may ask. Let quickly sum up. यहाँ पर हमने देखा केराटाइटिस के बारे में, इन्फ्लेमेशन ऑफ द कॉर्निया, कॉर्निया में आपका इन्फ्लेमेशन होना, इट इज नॉन एज दी केराटाइटिस। ये आपका वायरल बैक्टीरियल हो सकता है, आपका फंगल इन्फेक्शन की वजह से आपको ये हो सकता है, जिसमें आपका इन्फ्लेमेशन होना, आइस में आपका रेड आइस होना, आपका पेन का सेंसेशन होना, सेंसिटिविटी टू लाइट होना, वाटरी आइस होना, ब्लर विजन होना, डिफिकल्टी कीपिंग द आईलिड ओपन, आईलिड को ओपन करने में डिफिकल्टी होना, सेंसेशन ऑफ समथिंग लाइक सैंड इन द आइस, इस तरीके का आपको होना, बर्निंग सेंसेशन होना। ये बैक्टीरियल इन्फेक्शन वायरल की वजह से हो सकती है, फंगल की वजह से हो सकती है, पैरासाइटिक की वजह से आपको हो सकती है, इम्प्रॉपर क्लीनिंग ऑफ आई की वजह से हो सकती है, कॉन्टेक्ट लेंस को प्रॉपर वेयर नहीं करने की वजह से, प्रॉपर केयर नहीं करने की वजह से, इंजुरी की वजह से हो सकती है। इन केस रेयर केस में विटामिन ए की डेफिशिएंसी की वजह से भी हो सकती है। सो इट इज द इन्फ्लेमेशन ऑफ द कॉर्निया, कॉर्निया इज द आउटर मोस्ट पार्ट ऑफ द आई दैट कवर द pupils, the colored ring around the pupils. The most common cause of keratitis is the infectious or the injury. Got it? So all these are the causes and signs and symptoms of keratitis. Now treatment include like आपका medicine, आपका cefuroxime, vancomycin, ceftazine है ना, फ्लोरोक्विनोन, सेफ्ट्रिजोन, अमीकासिन, क्लेरिथ्रोमाइसिन, अमीकासिन और ट्राइमिथो prim. All medication is there. Steroid medication was also there because of the because of reduce the inflammation and provide the comfort and minimize the corneal scarring. Correct. Next, visual rehabilitation also is there, and patient may clinical symptom pain, photophobia, blur vision, and tearing and redness of the eyes may feel. Alright. So bye bye. Have a great day. Thank you for watching this.